Those of you who braved the snowstorm last year may remember that I talked about beer in my presentation. This year I'm talking about Coca-Cola. If we look at the screen there, you see on the left a large inflexible soda technology installation in a fast food place. Now, it doesn't look large, it gives you 6 or 7 different flavours, but it has a whole room in the back of the fast food place to deliver those sodas to you. And on the right is the CocaCola Freestyle, a project that Invetech coordinated and controlled the fluidics on, which has changed the way sodas are delivered to the market. So why are we talking about Coke and their success with the Freestyle? It's all about mass customization. It's delivering choice at low cost by managing the production supply chain better. And you can just draw a direct parallel to that with the delivery of autologous cell therapies. What we want is the prices of mass customization, the prices of mass production delivered to the patient at the lowest possible cost. So what are the parallels in the Coke machine and the cell therapy industry? Now, I had a bit to do with this project many years ago. It's microfluidic. We have to provide micro-concentrated ingredients at the right microfluidic volumes to get the flavour profiles of each drink right. I think when I checked 6 months ago, there were 128 different flavours coming out of that machine. I checked last week, there's 158. It's gone from 128 to 158 in a few months. All these different things being delivered by the one machine. And they do that by microfluidic control of all of the micro-concentrated ingredients which go into the front of that machine in effectively a photocopier cartridge style. And that replaces boxes and boxes full of bags of flavoured and coloured water that were being shipped around the country beforehand. Even the macrofluidics in that system, you're getting one of those buckets of 128 fluid ounces of Coca-Cola or a cherry Coke. That's a largish batch on the cell therapy fluids side of things. So both the microfluidics and the macrofluidics in that machine are directly mappable to cell therapy. The supply chain, I talked about the freight of those boxes. The data and the control on that, each of the Freestyle machines is Ethernet connected back to Coke head office. It provides usage statistics, it provides stock level, it calls for new shipments of ingredients when required. And so it's basically got the supply chain electronic and automatic, taking the people out of that and the cost out of that. Temperature control, the drink that comes out of that is, depending on how much ice you put into it, it's cold. The temperature ranges within the machine range from room temperature, there's a small heating circuit, maybe 38 degrees, and there's refrigeration. So you've actually got all of the process parameters you need within a cell therapy manufacturing system. You also, it's a zero carryover machine. I have it on good authority that once you run a micro-concentrated root beer flavouring through a plastic line, nothing that travels through that line after that tastes like anything but root beer. And when we're delivering cell therapies, we need zero carryover. Now, we may achieve it in a different way through a fully disposable aseptic set, but it's the same thing. So all the challenges of contamination apply in a soda fountain in a McDonald's as they do in the cell therapy manufacturing space. And overall, the integration and the execution of that project required project management, collaboration, the working of many different phases of that project and the pulling it all together and delivering a product. And even then, to the extent of sourcing a manufacturer who can produce them in a volume enough and ship them around the world to produce those therapies. So they're all things, hurdles that were overcome in the developing of the Freestyle system that are directly mappable to achieving the delivery of autologous cell therapies. So can it be done? Yes, we know it can be done because we've been involved in it in Coke's industry and we're facing similar challenges in cell therapy. So if we move on, there's a chart here that I'm sure you're all familiar with. You have Moore's law there, and you have the cost of genome sequencing mapped to that over the last 16 or so years. When I started preparing for this presentation, the cost of a genome was $1,000, so I thought it was very applicable. We're talking, how do we reduce from $100,000 of cell therapy to $1,000? And we had the same thing on the genome that took 12 years for that to happen, and you can see an inflection point, which I'm about to talk about in 2005-06. But last week, you could knock me down with a feather when I saw a news item saying that now the cost of the genome is $100. And that's a tenfold increase in the time it's taken me to write, or decrease in the time it's taken me to prepare for this presentation. So I was a bit surprised. So what are the parallels we can draw here? Well, we've got a time frame of about 14 years. We've got a cost target which at the beginning seemed ridiculous and impractical. So that sort of inspired us to put our title together, because I was accosted yesterday by a couple of people saying, we don't want to produce it for $1,000, there's not enough margin in the product. And I said, well, it's an aspirational target, and it's the cost of what you're producing it for. It doesn't actually dictate what you sell it at. You sell it at the value that the market will generate. So how did they do it with genome sequencing? Well, they established the National Human Genome Research Institute in 2004, and they successfully navigated collective funding, private-public partnerships, and they got a number of little companies doing incremental improvement, and then another company would build on that improvement and take it forward. And we just heard at the end of the previous panel, they're talking about collaboration. And Dr. John Lee of NantQuest yesterday was calling for collaboration. So I think that that's a very strong message for us as an industry, that we do need to collaborate to address some of the really chunky costs that are involved in the production and delivery of cell therapies. So, can we do it? We can see they've done it in Coke industry, they've done it in the genome, there's other industries where breakthrough change has occurred. So I believe that there is a real possibility of dramatic reduction in the costs. So if we move on to a little more detail, the COGs, they're killing us at the moment. Martin Andrews was just talking about $600,000 euro therapy. Preparing again for this presentation, I was looking at the organisations and obscuring the data a little bit, but we've seen therapies that costing between $70,000 US to $200,000 or $300,000 US to do the manufacture and a few other things. It's not the full cost of manufacture and administration, but I hadn't even envisaged getting up to the 600,000 euro. But all that says is the challenge is large and there's plenty of opportunity. So if we look at the typical small molecule margins, biotechs in that space, their cost of goods is about 10%. So that's a reasonable target I think we should expect to achieve in our industry, and that means we do need to realise significant cost reductions. If we look at one of the first products launched in the cell therapy space, Dendreon launched at 93,000. Their COGs was comprising, one figure I've seen is 77% of that. Another one I've heard recently is maybe it was 106% of that. Whatever, that's not enough to sustain a business, and we saw that in that case. So we need to get a handle on the cost. We need to understand it's not just manufacturing. There are other elements of that. So if we look, I'm getting ahead of myself again. If we look at where we need to be, people who know me in this room know me as a technology developer and innovator. My company, Invetech, has been at the forefront of the industry for 13 years or more now, explaining the need to automate and scale up and scale out. And you can see we've done that in industries other than cell therapy. So what do we need to do to leap to the factory of the future? I guess you could coin a phrase here, how do we move from the clean room to the ballroom? So we turning our attention more to the actual processes involved. The good thing about cell therapy production is that many of the processes involved in the manufacture are very similar. You've got to wash, you've got to separate, you've got to select your cells, there's transfection and transduction in many processes, there's eyes aren't quite up to the challenge there. You've got to expand, and then you've harvesting, and you've got fill and finish. And if we look around the industry, products like the Lovo, the Optia, Cephia have all either come on the market recently or about to come on the market. Products like the Prodigy and the Eyeline F from Avisio have been on the market for a few years. Invetech developed the KCEP, and we've developed a counterflow centrifuge product with PCT in a collaborative environment. So there's a pipeline of new and improved products that are on the way. But the issue with these is they're all addressing individual unit processes, and to drive sort of substantive costs down, you need to integrate these things together. So we need breakthrough innovation to make this happen and make it happen faster. So achieving the future state will be a journey. What do I see the progress of that being? I see that we're going to move to configurable GMP modules, which are probably still doing 1 unit process or 2 unit processes to start with. And over a number of years, we will then move to more fully integrated machines, getting closer to managing the whole process. And we're going to be addressing the challenges of production, QA, QC, vector and growth factors, and supply and logistics. And depending on your therapy, those 4 areas, they might be equal, they might be balanced one way or the other, but there is significant component of cost in all of those areas, and you don't get dramatic cost reduction without looking at them all. So I postulated here a cost of a cell therapy. It doesn't quite reach Martin's 600K, but if you look at the high end of those, you're in 140,000 US across production, and I've broken that down across the 5 process steps there. But you've also got your vectors and growth factors producing a significant component of that cost, the logistics and the QA, QC. So all of that builds up to a very expensive process. So where are our opportunities within that? Well, with the production opportunities, you've got processes such as cell selection, cell culture, cell harvest, formulation, fill and finish. They can all benefit in improvements in the quality and consistency of the input material, cheaper and better and more convenient and less of them, aseptic connections. We've got to capture the data. I mean, I can envisage an aseptic connector, which is not only a fluid connector, but it's actually an integrated data connector. It takes the control information from the system, it runs the process, and it takes the batch record information back out into the MES or the batch record system. We can perhaps develop sequences, a recipe for a therapy, develop and load that in a day, run the V&V the next day. At the moment, that process takes 6 months with a dedicated system, a bunch of pieces of equipment that will need to be provided, validated, run through the OP, the IQ, OQ and PQ, and that might take 6 to 8 months. So I can see that happening within a week once we get this industry to a mature stage. We need to integrate and automate currently discrete processes into common equipment, and we need to delink the operator time from the process time. The machine needs to perform and record, the operator monitors the process. Moving on to vector production. We've got an opportunity here to move up the supply chain. And maybe this is the best opportunity for an initial collaboration, because we all need the products from this, but the manufacturing processes and the formats that it's delivered in are not suited to our industry yet, and that drives for increased costs. So we need to maybe pull together a consortium so we can look at growth factors and vectors. And I know we've got a couple of companies in Akron Biotech and Biotechny who are very interested in working with people to get better at delivering their products in formats that are appropriate to the manufacturing process. QA, QC, don't test every batch. At the moment, every autologous batch is its own single patient, single batch, a full batch record. Once we have statistically significant numbers of patients treated, we should be able to move to statistical process control and just be testing the supernatant or waste pulling in that, and we know that the batch is okay, but we don't have to do all of our batch release things. Now that's, it's a pipe dream at the moment, but it's where we drive significant cost down in the QA documentation and batch release process for autologous cell therapies. Logistics, point of treatment manufacturing. We take out the shipping, the product is collected, frozen, shipped to a factory, produced, frozen, shipped back to a patient, thawed, administered. All of that can add tens of thousands of dollars to the product. But if we had a Coke machine for cell therapies in a treatment centre, the patient comes to that treatment centre, they have a sample taken, maybe 9 days later they come back and they get the product administrated. Your logistical costs have been slashed by 100-fold. And there are companies like Systemic who are testing their mRNA in waste and supernatant with low-cost technologies, which are much cheaper than building a flow cytometer into every one of these machines. So we need the industry to drive to those sort of things. We need low-cost sensing technologies to deliver those. So here's again another hypothetical. I've got a $1,000 therapy there with all of the boxes adding up to $1,000. Maybe we can't get all the way there, but if we're at a $3,000 therapy and you're selling it for $30,000, we're a whole lot more affordable than a $600,000 therapy, or a €600,000 euro therapy indeed. So I can see Chris about to wind me up. How do we get there? We need new approaches, we need to use disruptive thinking, and we do need to collaborate. And I know the panel was talking collaboration as they closed, and I thought that was, again, another great lead into this topic. So to get to the future state, we need to move out of the clean rooms and the biosafety cabinets into controlled non-classified spaces. We need to move from manned operation to automated unmanned operation. We need to move from controlled manufacturing to point of treatment manufacturing. And I believe we can get from $100,000, we can make our 100-fold reduction in cost